So it's Friday, so it's time for Poets. Some of us know that as Push Off Early, tomorrow's Saturday. But in this context, it's the Perioperative Enhancement team. Inspired by Dr. Sol Aronson and the team at Duke, a selection of clips to get us thinking about the next steps in providing world-class perioperative care. You'll find the full lectures in our back catalogue, or join us at the upcoming Perioperative Practicum for expert discussions, business case tips, and hands-on workshops. Go to www.edpom.org and look for our international programme of perioperative practicums. TopMedTalk.
This piece, entitled Surgery School, is presented by John Moore, Adult Critical Care Clinical Director and Consultant Critical Care and Anaesthesia at Manchester. Have a listen.
Patients should be empowered. It's a big word in the NHS, patient empowerment. How you get people to train for their operation. And similarly, when we talk to patients and their families, it's about a partnership. It's not paternalistic. We're not talking down to people. We're saying, collectively together, how are we going to make you get better after your operation? And that's the way to frame it for patients and their families. They get the idea. We're saying to them, oh, it's about me and my operation. They take ownership of their complications and their surgery as much as they're able to. And that encourages training. And also how we get it right in hospital, which I know there's lots of excellent work going on in the colleges for that at the moment. Again, how we support people into recovery and understanding our outcomes. So we needed something to help us do the education. So we came up with Surgery School. And I know that Surgery School was preceded by Joint School, which is around orthopaedic surgery, and that was very successful. And we looked at Joint School. And Cardiac have been doing it for 30 years. They have had cardiac surgery type surgery schools for 30 years, but it had not been done before in major non-cardiac surgery. So we developed Surgery School at our hospital. And it's a weekly session, which we run every week. We've had more than 2,000 patients and their families through that programme, which I think is a good number of people. And more than 1,000 other sites, 2,100 sites around the country. And there they meet someone like me, a medic, a physio. They meet one of our nurses. They meet our pharmacists, and they often meet our dietitians as well. So it's a multidisciplinary team for someone like me to frame it for them, and they understand the importance that by being a medic, that us being at that meeting helps. They say, oh yeah, I get that. That makes it important to me to understand that this is an important thing I need to be aware of and to do. And the patient feedback around this process is very, very powerful. They really get the idea that someone's saying to them, this is something you can do. And we say to them, listen, you're going to have an operation. It's a physiological insult to your body. Frame it for them in that way. They do understand that. They're not overpowered by that information. These are people dealing with cancer, majority. So this isn't a new thing. They're not, and you say to them, let's prepare you for it. And we frame it in 4 nice, succinct ways. We say, listen, activity and muscle training is a good thing for you. Let's understand what you're going to do that. We talk about chest training, which we'll come on to in a wee second, using the ICOF stuff. We talk about nutrition. And we say to patients who are about to have cancer, know your weight, don't lose weight before surgery, because cancer patients are being told in our hospitals to lose weight before their surgery, which is absolutely crazy, but they are getting told that. And also watch your weight after your operation, because patients will commonly lose weight after surgery when they've gone home for those first few weeks. And we talk to them about this stuff. Family and friends is a big thing. The psychological support that patients get from their families is massive. So we invite the family to see Surgery School and we say, listen, we want to talk to you as well as the patient, because we want you to be the coach that says to them, listen, I want you to do all this other stuff that was really, really important. And they really get that. And we talk to them about smoking and alcohol. And we're framing smoking as a disease. It is a disease because most of people start smoking in childhood. So to say it's not a disease, we need to approach it in that way, and we need to give them pharmacological assistance to stop smoking. And that's what we're doing with the CURE programme in Greater Manchester. We talk about alcohol, we talk about anaemia, those things for patients. And they hear from our physios and our nurses. We talk about pain. We say, listen, you're going to have some pain at some stage after your operation, because some people still think they will have no pain after major surgery. So we say, we're going to look after your pain, tell us about it. We have a conversation with them about those things. We talk about activity and muscle strengthening in a way that people can understand and what they like to do, which we'll come and talk about in a few minutes. But we try to say to them, from today, go away and start exercising and be active. 10-minute blocks each, 2 to 3 a day. That's what you need to be doing before your operation. And we talk about chest training. Chest problems are common. We explain to them that chest problems are common and what might happen to them after the operation. And we use this at the moment as our package for that. And we explain to people, you're going to get out of bed after your operation. You're going to brush your teeth. Really important thing, brush your teeth before you go downstairs and have your operation. In the morning, use mouthwash a week before and a week after your operation. All these things. And then we show them around our HDU as well, because we say it's important you come and see what's happening. And they see other patients that have had surgery doing exactly what these guys are doing in terms of what we say to them. And we get them out of bed, and we get them to brush their teeth, and we do all these other things, and we get them to use a sensorymeter. And we get people to measure it. We mobilise people and we prescribe it. We say you should mobilise patients. Right, and we prescribe it. And we say you should brush your teeth. And if I would say to anyone, if they go back to their own hospital, say, do we brush our teeth all the time in hospital? Your hospitals don't. Because when we've measured it, it's usually 20 to 25% of the time people brush their teeth twice a day in hospital. Because it doesn't fit in with the nursing regime. In the evening time, nurses don't do that as part of their night round. And we talk about recovery. Because the surgeons often don't tell patients what they need to do after they've had their operation. So we're trying to fill those gaps and talk about how people get better after the operation. And we showed a reduction in respiratory complications after surgery. Absolutely quality improvement all over the place. It's not an RCT. But over 3 years, we reduced problems with a length of stay reduction. That's led on to some health foundation support. So they're giving us a scaling up project innovation over 2 years in Greater Manchester, where we are now, trying to spread this idea. And that will be the test of the pudding, really, in terms of what we can do across these sister hospitals. But we've opened it up, and we've had more than 30 other hospitals come to see us in Manchester and say, well, how do you do surgery school? Which bits do ring true with us as a hospital? We would like to do something like that. And one of my colleagues, Danny, had the nice job of visiting Australia to talk about surgery school, and they're now running it in Melbourne. As Danny mentioned, there is something in this because they've shown in Australia in a randomised control trial 50% reduction in respiratory complications by a physio talking to patients before their operation in a surgery school type way. And there's something in what they talked to them about was the lip smack stuff in terms of their respiratory breathing, how they take deep breaths, all those sorts of things together. So there really is something in how we approach patients before their operation. So if I was going to do surgery school, well, what do I need? Well, you need interested people. And you ideally need a surgeon alongside these guys, but you need your nurses, physios, dietitians. You need consultant time that needs to be fed in from somewhere. You need admin support to help you funnel those patients into your pathway, because otherwise it's extremely difficult. And ideally you need this person, an enhanced recovery nurse, or someone that can be badged as such, because someone needs to make sure this stuff happens afterwards. And you probably need some sort of business case to make some elements of this work, and we can help you with all of those things. And you need to measure what you do. Because if you don't measure it, you can't say to yourself, well, actually, that did work. And that's part of your business case, is measuring your own outcomes. And I would suggest PQIP is a really good starting point for that. We've developed a website, as I mentioned, and all the resources are on that for you, if you'd like to look at them. And they walk you through all the different elements of that in terms of the things that you might use, how you might support patients. And colleagues around St George's and Bristol, what they're doing is they're looking and they say, we like some of it, but we're going to make it our thing. We'll take bits out of it, which is exactly what it's for, alongside all the other work that's happening around the UK. It should be, all these resources are free for people to use. The last few minutes, I would just encourage you to look around your hospital and come outside of your hospital. The big jump that I made was contacting the leisure providers in Manchester and Macmillan. And these guys are waiting to be contacted by you. How do you get hundreds to thousands of patients physically fit and recovering after major surgery? I think you have to take it to these guys, alongside our support for the high-risk people. But these are the social leisure providers can work with us. And we're working with colleagues across Greater Manchester to have packages set up for people before and after surgery. Because that's where we want them to go. But also patients need choice. They don't all want to go to the gym. Some of them like the idea, particularly the high-risk patients, of having a hospital-supported programme. Some of them like voluntary support, like walking groups. Some of them like to do it in their own home with a phone call. And that's what we're working at. Can we sort out someone with a bicycle, which you can get for £70 with a weekly phone call from your leisure provider? Doing it at scale and at lower cost. And our website suggests that to patients. Get active where you live, not where the hospital is. So if I live in Wigan, I don't want to come down to South Manchester. I want to get fit in Wigan. And that's what we should be trying to do for patients. So work with your local resources, your primary care, your leisure providers. Now, these are a really, really good group of people to work with Macmillan. There's 10,000 people who are funded by Macmillan that work in healthcare. Now, we came to know about Macmillan. Surgeons know about Macmillan. They know how to work with them to get transformational money. So if you're trying to do a transformational perioperative project, I would suggest you talk to your local Macmillan team. They have funds that you can apply to. And they'll be the people that you can talk to about this thing. I'm not sure if you've heard of this before. It's called the recovery package. And this is how Macmillan sees cancer care. They talk about health and needs assessment before someone has treatment. And what we're saying to our colleagues in GM Macmillan, well, talk about activity, nutrition and well-being. Similarly, after your operation, care review, activity, nutrition and well-being. Let's get all of the systems saying the same stuff. And they run something called a health and well-being event, which traditionally it's 6 to 12 months after your operation. We're saying, let's bring it to 2 to 3 months and call it, well, recovery school, if you like, or something like that. And we'll talk to people about how they recover after their operation. Now, every trust in the country should have this in place by 2020. That's the challenge that Macmillan have set us. So it's happening at the moment. And Macmillan are moving, as I say, from long-term survivorship land into prehab land. So I would speak to your local Macmillan teams to talk to them about what you'd like to do. And it sets itself up for, well, it sits as a holistic approach where you have something like prehab sitting aside the recovery preparation packages, all of the system pointing the same way, how we get people to be active before and after their operation. And finally, and we're going to talk about digital in a second with some CPET stuff, but remember that now everyone that we operate on or anaesthetize, most of them have a smartphone. In the last 5 years, it's gone from 25 to 75 to 80. We're measuring it now in Manchester. It's nearly 85% of our patients coming to surgery school have got smartphone technology. It's the obvious way to educate people about their care and how we support them. So we've developed a surgery school type, ERAS Plus type app that walks people through their preparation and recovery after major surgery. And it's a support tool aiming to support people, and it has some functionality within it that assesses the patient's beginning function. And we're just starting to trial that, hopefully, in the next few weeks. And the idea with that, the next version of that, well, let's reflect that back into healthcare. Let's monitor our patients as they prepare and recover from major surgery. Going back to cancer, it's not just about surgery. And you start to think about this, you think, well, anything else, such as chemo and radiotherapy, would benefit from an accelerated recovery program. And that's the sort of things I think we can do within perioperative medicine. Thank you very much for your time. Thank you.
TopMedTalk.
Nate Majerison here. Thanks for listening to TopMedTalk. Now, before we let you go, it's important that we remind you to subscribe to TopMedTalk. That way you'll never, ever miss another episode. Also, if we could encourage you to join us on social media, Twitter, Facebook, LinkedIn, YouTube, pretty much every single social media platform, we're there. Join us. And finally, check out TopMedTalk.com. If you go to our website, you can subscribe to email updates. That way we can always tell you where we're going to be, what we're going to be doing, and how you can join us. TopMedTalk.com and click on the section marked email updates. Finally, TopMedTalk is proud to act as the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about them as well. ebpom.org is their website. That's ebpom.org. And if you go to ebpom.org/meetings, you can find out about some of the wonderful meetings that we attend and cover across the year here on TopMedTalk. That's ebpom.org/meetings.